Thank you, Rachel, and thank you everybody for taking the time today to help us learn a little bit more about the health concerns of people with Prader-Willi syndrome. I wanted to start off by thanking and acknowledging some people who helped make this project possible. First of all, I wanted to thank Dr. James Loker, Dr. Dan Beaver, and Desiree Dykstra for their review and editing of the content of this presentation. I also wanted to thank all the individuals with Prader-Willi syndrome who allowed use of their photos. And I also wanted to acknowledge the University of Wisconsin Weissman Center, the Community Training and Outreach Program, as well as PWSA USA for their support of this project. This presentation is going to be focusing on some of the most common health issues often seen in persons with Prader-Willi syndrome. And it highlights some of these things that you can do to prevent and or manage these concerns. You are a very important part of the healthcare team. And you definitely know the person with Prader-Willi syndrome far better than the person that you may be seeing, the healthcare professional that you may be seeing. Don't be afraid to educate and to share information. Be respectful, but at times you might have to be persistent. There are many factors that influence our health. Lifestyles, habits, and family history are just a few examples. So everyone with Prader-Willi syndrome is an individual, and they may have individual health needs not mentioned here today. I want to point out that this presentation is not meant to contradict any recommendations of a healthcare professional that is caring for the person with Prader-Willi syndrome. They are intimately knowledgeable of the person, of the situation. Once again, I will emphasize, if there's something that you're wondering about, please don't be afraid to ask questions and share information. If you're using this website as a training tool, I have provided a study guide for you. And that participants will be asked to fill in the blanks where there's yellow highlighted words in this presentation. And there is a test that I also shared with the handouts that you should have received in an email. So these are the handouts that you should have received in the email. There's a study guide, like I said, and you fill in the blanks with the yellow highlighted words. Other resources include a copy of the PWSA USA Medical Alert Booklet, which it's the download version. There's a copy of the Bristol Stool Chart. There's a copy of the Medical Alert for healthcare providers in an inpatient setting. And there's also that optional test available for those who may want to use this as a training tool. Okay, so in many ways, the body of a person with Prader-Willi syndrome works differently than yours and mine. And that's a key factor in trying to explain this to healthcare professionals. A problem in their brain affects their ability to control their appetite, to regulate their body temperature, to feel pain accurately, to produce many hormones, to have strong bones, to swallow and digest their food properly, and control their emotions, and finally, to learn and understand things. Because of a dysfunction in the area of the brain called the hypothalamus, people with Prader-Willi syndrome always feel hungry. They will keep eating, and they will never feel hunger. When they eat, the message of fullness never reaches their brain. In some people with Prader-Willi syndrome, this food drive is very intense. In others, it is not. So not only do these individuals feel hunger all of the time, they also have a very low metabolism and lower calorie needs, which makes gaining weight very easy. So without your help using food security, they can overeat, become morbidly obese, and in some cases, even rupture their stomach. People with Prader-Willi syndrome rarely vomit. If they do, it could be a sign of a serious problem. So what are things that you can do as caregivers? First of all, you want to monitor all sources of food everywhere. And that may seem easy, but it's very challenging. Food security is life-saving. This can be done in a number of different ways. There can be locks and/or alarms, precise planning for all activities where food could be present or impacted. You want to plan, structure, and prepare all meals, and a low-calorie diet is needed. Once again, and you'll hear me repeat this throughout my presentation, if anyone with Prader-Willi syndrome vomits, they should be evaluated by a healthcare professional. When you see a healthcare professional, you will want to share a recommendation of a detailed plan of a workup for GI complaints, which is just a fancy word for stomach problems, which is included in the PWSA medical alert booklet to help you advocate for what and why an evaluation is needed. I will be going into that and sharing that again later in my presentation. So life-threatening obesity is still a health risk factor that is a lifelong challenge that we are trying to manage. So even though we have learned a lot about managing diet and food security, people with Prader-Willi syndrome may still gain a lot of weight. So those who are very overweight may experience serious health issues, including heart and circulation problems, which may include high blood pressure, heart failure, extreme swelling in their legs and feet. They may also experience breathing difficulties that may require oxygen and other treatments. And diabetes is also a health condition that is impacted, that can occur in life-threatening obesity, which impacts the heart, eyes, kidneys, blood vessels, and healing. And I can't tell you how many times over the years I've heard people say, well, my loved one, they have diabetes, but that's it. And I try to explain to them that condition impacts every organ in the body and can result in very serious lifelong health complications. So you always want to work with the healthcare professional to treat and follow the care recommendations for the health issue of concern. It is imperative to help him or her lose the weight. You want to monitor their weight daily. You want to have careful adherence to a low-calorie diet or any other prescribed diet. You want to have them exercise as tolerated. In the beginning, it may just be very low impact, short distance, and gradually increase. So I would strongly recommend consulting with a physical therapist or an exercise physiologist if you are trying to help a person who has life-threatening obesity in the area of exercise. You want to help to avoid having them sit for a prolonged period of time. Many people with Prader-Willi syndrome, especially those who have not been on growth hormone, are short stature. And when they sit in chairs, their legs physically dangle and they aren't supported on the floor. And so we want to elevate their feet and legs. And if needed, put a stool under them, get them up, get them moving. Use circulation stockings as ordered. But we want to try to do everything we can to minimize the accumulation of extreme swelling in the lower extremity. Next, we're going to be talking about GI issues, things you need to know. And the first thing, we're going to kind of go from mouth to the anus, from head to toe here. We're going to start with swallowing problems. So recent research has shown that many people with Prader-Willi syndrome often have problems with swallowing. During these studies, food was caught in their throats and they were not even able to tell. Most people with Prader-Willi syndrome have a low production of saliva, which can contribute to swallowing problems. Another factor that can contribute is that they often eat very fast, which also puts them at risk for choking. So things that we can do to help with this problem. There's the chase and pace strategy, and that is an approach that slows the rate at which a person eats and helps them to lubricate and moisten and move the food down the esophagus. So it's a very simple strategy. Basically, each bite of food is followed by a sip of water or some other liquid. Once again, it provides moisture and it will help push the food down and prevent choking. You may also want to try other measures to help slow them down. Have them put an eating utensil down between bites. You may also try just giving them smaller portions, and if needed, then they can have seconds. But if they don't have a large portion there to literally put down at one time, it can lower that risk. You want to provide food that has moisture built in, such as soups or food that have sauces. And sauces can be natural, low-calorie, water, natural juices. They aren't necessarily the high-calorie ones. You also want to make sure that all staff are trained in the Heimlich maneuver. The second topic that we're going to be talking about is slow stomach emptying, and this is called gastroparesis. So many people with Prader-Willi syndrome experience slow stomach emptying. Normally, when a person eats, the stomach breaks down the food and then it propels it and pushes it into the small intestine to further digest it. When people have a condition called gastroparesis, the stomach is unable to contract normally, and that food is not crushed nor pushed into the small intestine properly. So the stomach contents can build up, causing bloating and distension. When this happens, normal digestion stops. And if it's not addressed immediately, the stomach can rupture and result in death. The first symptoms that it could be happening is when a person vomits. So symptoms you might see are bloating or distension of the stomach. And I'll be honest with you, in a person with Prader-Willi syndrome, this is often difficult to detect just because they tend to have, they're not often slim and trim, and they do have a little bit of distension just normally. The big key is vomiting. People with Prader-Willi syndrome rarely, if ever, vomit. So this could be a sign of a serious problem that needs to be evaluated right away. They could complain of stomach discomfort. People with Prader-Willi syndrome do not experience or report pain accurately, so they may not complain of stomach pain per se. So it may be just a kind of an unusual sensation. It just feels funny. You want to kind of take note of that and really start looking at a possibility of what may have happened. Things that make this problem worse: overeating and or binge eating, which is just ingesting too much food at one time. And that's where that contents in the stomach becomes overwhelming, and that could rupture and the person could result in death. High fiber foods and fatty foods are harder for our stomach to digest and are harder to be pushed through the stomach. So they tend to just normally, even in you and I, stay in our stomach. It requires more work. People who suffer from gastroparesis many times have to be hospitalized, and they have to have a tube put down into their stomach and remove the contents until the stomach starts to work properly. If a person with Prader-Willi syndrome overeats, vomits, or complains of abdominal pain or discomfort, seek medical attention. Once again, bring a copy of the PWSA USA Medical Alert booklet, or I've also included the download form. It can also be found on the PWSA USA app or on their website, which is www.pwsausa.org. So you can have it at your fingertips when you're going to need to be educating and advocating for further workup. You want to serve lower, not no fiber foods. And how we make some of our higher fiber foods lower fiber foods is to soften them. And that's just really making the stomach work less to digest and break down that food content so it can move into the small intestine. This can be done by cooking them rather than giving them raw vegetables. If we give them cooked vegetables, it's softening the foods. Putting fruit in natural juices or sauce. Instead of giving them an apple cut up, we would give them apple sauce or apples in natural juices. Instead of giving them a steak, what we may want to do is give them ground up meat, giving them ground turkey, ground chicken, ground beef. It's just less work for the stomach to have to break that item of food down. So this is a copy of what's called a algorithm or a plan that is in the back of the medical alert booklet. That can also be downloaded from the PWSA USA website. But this really gives the healthcare professional explanation and a plan of what needs to be done if somebody comes to their office, to their urgent care, to their ER with complaints of GI problems, especially in the case of abdominal distension and vomiting. You want to increase liquids in cooking. Liquids require less work to digest, so they pass through our stomach a lot faster than if there is something more solid in there. Good example of that is soups. It's softened up, there's lots of liquids, and it helps to push through. So to have a soup night once a week would be a really good idea. You really want to avoid high fiber foods. We used to push salads, raw vegetables, raw fruits for persons with Prader-Willi syndrome. Now we know that they're at risk of having gastroparesis and that it could cause more problems. So we want to really try to avoid some of the foods that we used to be pushing for. We want to provide smaller quantities of food at one time. You want to avoid large meals. And I know we run into this dilemma at the holiday time, especially at Thanksgiving. We tend to eat a larger quantity of food at one time. Well, instead, we want to maybe try to break it down and maybe have the fruit like an hour or two before you have your main meal. And make sure that you have to have your main meal and maybe save the dessert for an hour or two afterwards. That's the most challenging time of the year in our family is during the holidays. But you want smaller amounts of food going into the stomach at one time. You want to try to include probiotics. Some natural probiotics are yogurt, kefir, sauerkraut is another example. And if needed, you can consult your healthcare professional for the use of a probiotic that can come in a pill form. You also want to try to keep the person upright after eating. Maybe have them go for a walk. We want to use gravity to our advantage. Help push the food down through the stomach and into the intestine. Walking just is a activity that helps to promote the contraction of the stomach as well as the small intestines. Let's work with Mother Nature. You want to make sure to provide fluids and adequate hydration. Once again, liquids pass through the stomach quickly with minimal work. And that's another uh, good reason to be having them included in your meal, one little sip to assist with swallowing and to help with digestion. People that have severe cases of gastroparesis often have to have a pureed diet. That's an extreme measure, but in some cases, that is oftentimes necessary. And I have heard of short-term use of the pureed diet because basically it's minimizing the work that the stomach must do. The next GI issue that we're going to be talking about is water intoxication or drinking or ingesting too many liquids. So did you know that drinking too many liquids, especially at one time, can make you sick? So when anyone, even when you or I, drink large quantities of liquids, especially water, it disrupts the balance of chemicals in our body, and it can cause confusion, dizziness, muscle weakness, headache, stomach upset, and could even cause seizures. Because of an altered pain response, people with Prader-Willi syndrome may not complain of that headache, and they may not experience the stomach pain or upset. So diagnosing this in a person with Prader-Willi syndrome or detecting it can oftentimes be very challenging. Things that you can do. Do not allow the person with Prader-Willi syndrome to purchase and drink those very large quantities of drink, even if they have no calories. And I can tell you in the cases of people that I know with Prader-Willi syndrome who have experienced this, one was because of a large, had consumed at least one and maybe even two large beverages from a convenience store. And staff thought, well, you know, it doesn't have any calories. There shouldn't be a problem with that. And another case that comes to mind with me assisting a person with Prader-Willi happened in a hospital where a person was getting large quantities of diet beverages. They'd call and ring the bell and a nurse would bring them a diet soda. They'd call and ring the bell and a nursing assistant would bring them the beverage. And pretty soon the person ended up having seizures, and it was due to water intoxication. We do want to water or other liquids in like 6 to 8 ounces every 2 to 3 hours. It's that small quantity at reasonable time frames that can be helpful. If you suspect a problem and you know that they just accessed and drank large quantities of fluids and their behavior or are starting to change, please seek medical attention. Okay, things that you can do for constipation. Constipation is a common problem seen in persons with Prader-Willi syndrome. It takes longer for food and waste to pass through their intestines. So oftentimes, people with Prader-Willi syndrome may have a bowel movement every day, but it's small, and there's really incomplete emptying of their colon. So that means that they can be having BMs and still be constipated. According to the American College of Gastroenterology, constipation is defined as unsatisfactory defecation, otherwise known as pooping, with either infrequent stools, difficult stool passage, or both. So any recent change in bowel habits or persistent changes in bowel habit may be cause for concern. And people with Prader-Willi syndrome have many causes for constipation. And to be honest with you, this isn't unique to people with Prader-Willi syndrome. Many people with developmental disabilities tend to have problems with chronic constipation. So they may experience poor muscle tone and sluggish contraction of the muscles in the intestinal system. They have low physical activity. They have poor water or fluid intake. They may be taking medications that can also contribute to constipation. And they may not have enough fruits and vegetables in their diets. So what are some things that you can do? First of all, we should be monitoring bowel movements. Are they hard and dry? Do they strain to push them out? Can you hear them when you're standing outside the bathroom door as they're trying to have a bowel movement? I have provided you with the Bristol stool chart as a guide to know what, how can poop look when it's constipating. And I will also be looking at that here in just a minute. You also want to offer water and fluids every 2 to 3 hours. The longer stool or poop remains in your intestine, the more water gets absorbed out of it, the harder it gets, and the more challenging it is to move it through the intestinal system. That's why fluids are so important. You want to provide a well-balanced, low-calorie diet, which includes softer, lower fiber fruits and vegetables. And in some cases, and in many cases, you may need to administer laxatives and follow a plan for managing constipation as prescribed by a healthcare professional. You want to encourage activity, especially after eating. A short walk, even down to the mailbox after supper, is a great idea. Just work with Mother Nature, get those intestines contracting. Walks, even short ones, can help. Another device that I have heard anecdotally to help in many cases, it's called the squatty potty. And it's kind of a stool that's designed to help position your colon into a squat position while they're sitting on the toilet to help a person have a bowel movement. And it's available at many, many stores across the nation. So this is that Bristol stool chart that I was talking to you about, and that I did include in your hand. I'm sorry? The Bristol stool chart. So this really helps you identify when somebody is really having severe constipation, mild constipation, whether it's a normal bowel movement. But this handout was included with your other handouts as well. It just helps you to know what are we working with here. Okay.
I can see you.
Next, we can talk about body temperature problems. And I'm going to be talking about the area of the brain called the hypothalamus, helps us to regulate our body temperature. So this area does not always work properly in people with Prader-Willi syndrome. Most people with Prader-Willi syndrome have a lower than normal body temperature. Many can also overheat very easily. They may not have a fever even when they are sick. So that body temperature regulation, both high and low, is not working properly in persons with Prader-Willi syndrome. So you want to know the baseline temperature of the people that you support. It's just a good idea to maybe do random checks of it maybe twice a month. And in most cases, it's usually in the 97.4, 97.6 range. Most people tend to be at the lower end, not at your 98.6. If illness is suspected, even if a fever is not present, you should have them evaluated by a healthcare professional. And when you do take them in to be evaluated, you need to help educate the healthcare professional on this aspect of health concerns in people with Prader-Willi syndrome. So a person maybe who has strep throat may not necessarily be running a fever. People who have influenza may not necessarily be running a fever. So you may need to advocate a little bit more aggressively for a throat culture or a blood test to rule out an illness. Many people with Prader-Willi syndrome feel cold at temperatures that are not real cold for those of us who don't have Prader-Willi. So they may need warmer clothes in cooler temperatures, and they may need guidance in dressing appropriately for the weather. So and this can be very much a challenging situation. You may need to keep the thermostat in the home to a reasonable temperature. They may not need the air conditioner set at very cold temperatures, or the thermostat set to very warm temperatures if you're living in colder environments. You have to try to come to a compromise. So in warmer temperatures, you may have to limit the time and activities in warm environments. So if you do have an outing planned outside and it is warmer outside, you might need to, limit the amount of time that you're there, have a plan in place that you're going into air conditioning at intervals. You also want to make sure that they receive adequate cool liquids. And you also want to encourage for them to dress appropriately for temperatures. And like I said, can be the challenging part. You don't want to argue with them. If needed, you may need to make sure that they are in a cooler environment if they are insisting on wearing warmer clothes than appropriate. I remember once visiting a home of a gentleman with Prader-Willi syndrome, and he was out mowing his lawn, and it was probably an 85-degree day, and he had a jacket on, and his face was red. And I was talking to staff saying, he is at risk of developing a heat stroke or heat exhaustion. And he insists upon it. So I kind of interrupted him and used my visit as a way of kind of breaking things up. And I talked to him and I said, would you be okay with maybe if you mowed the lawn 2 times across and then came into the air conditioning house and took a sip of water, cool water? And he was willing to do that. So trying to figure out a compromise with them to see about trying to limit. I did try to get the jacket removed, and he was not going to take the jacket off. But we were we were successful in coming up with other cooling measures for him when he mowed the lawn. In very cold temperatures, you want to limit the time in activities outside. And here in Wisconsin, when we have things called polar vortex, this is something that we have to face on occasion. You want to make sure that when a resident leaves the home for any outings during this colder weather, that they are dressed appropriate to face those conditions. The person should be wearing a hat, gloves, and a coat, as well as being dressed in winter clothing. And it's been my experience, many people probably overdress in the winter. It may be 40 degrees and they want to wear the hat, the coat, and the winter jacket. But if an individual refuses to wear appropriate clothing, once again, avoid a power struggle. Staff should take the items along. You get them into the warm van. You get them dropped off close to the entrance. In the event of snow accumulations or icy conditions or extreme cold, staff should err on the side of caution, and you may need to reschedule plans. Altered pain response. People with Prader-Willi syndrome do not always feel pain accurately. It's not to say they don't feel pain, okay? But they can be injured, have wounds, and painful conditions that don't hurt them very much and sometimes don't hurt them at all. There have been reports of persons with Prader-Willi syndrome having ruptured appendix who do not even complain of abdominal pain. They may not report a headache, have a sore throat, or other symptoms when they have a medical problem. They may have broken bones and not complain of severe pain. This makes knowing when someone is sick or injured very challenging. This is a picture of my son, Tony, and he had a fall in which he landed on his hands and fractured both elbows. He was taken to an emergency room and evaluated. And to be honest, only one of the fractures was caught because the other one, he didn't really complain of any discomfort. I noticed it when he was unable to use that arm in the proper way. So you need to take complaints of pain seriously. If complaints persist, have them evaluated by a healthcare professional. So when a person falls or if they're injured, you want to closely evaluate them at the time of injury. And every 4 hours, for at least 24 hours, you want to be watching for swelling. You want to be watching for pain of any kind and their inability to use the affected area in a normal fashion. If they're guarding it and they're not turning it over, or if they're not, if they're walking funny on something, that's a concern that needs to be evaluated. So you want to seek medical attention immediately if they're complaining of moderate to severe pain. And if you're questioning, because some people I know many times, oh, it hurts. Well, we're going to keep an eye on it even for 10 minutes. After 10 minutes, if it's still moderate to severe, you want to make sure that that gets evaluated. If they have an area that looks deformed, and I'm going to say that it just doesn't look right. And I can tell you that I have helped diagnose broken bones by just going, gosh, that just doesn't look right. I do not have x-ray eyes. I cannot tell if a bone is cracked or fractured by visual alone. So sometimes it's just that feeling that it doesn't look right. And if they're not using or moving their hand, arm, foot, knee, or leg in a normal way, get it evaluated. You can seek medical care later. So if they seem to be okay, you know, the pain seems minimal, the pain persists. So if it's the next morning and they're still complaining of discomfort, then it should be evaluated. You want to utilize first aid measures if needed right away. Ice, elevation, and rest. Just like you would for you and I. We have to be their guider in doing appropriate measures because they don't feel the pain normally, so they may not be the one requesting these measures for first aid be taken. Once again, if you do seek medical attention, we want you to bring the PWSA USA Medical Alert booklet or use a phone app or use the website, whatever it takes to help educate. Diagnosing any medical problem or injury without using pain as a criteria can be very challenging. I tell that to almost with Tony with his fractured things and injuries and even illness. I always start by saying he's going to be a challenge, a diagnostic challenge for you because you're not going to be able to utilize pain as your number one tool for trying to figure out what's going on here. Don't be afraid to ask for an x-ray or other testing to eliminate a more serious problem. Fragile bones is another health condition often seen in persons with Prader-Willi syndrome. So it's also known as osteopenia, which is kind of at the lower end, and osteoporosis, and that's at the severe end. So this is a picture here of a normal bone, as you can see, that's filled in, and there's close proximity, and a bone with osteopenia where it's just wearing away. Because of hormone deficiencies, people with Prader-Willi syndrome may have fragile bones. So many people take medications and hormones to help their bones get stronger. Examples include calcium, vitamin D, growth hormone, estrogen, testosterone. Fragile bones, low bone density, this problem has been found in people with Prader-Willi syndrome of all ages, even in children. So this puts them at high risk of spine problems, spine curvatures, and undiagnosed broken bones. We're seeing as people with Prader-Willi syndrome are aging, we're seeing more problems with spine curvatures. Many are at higher risk for falling and experience problems with walking. Some require use of a cane or a walker. Low bone density, fragile bones, soft bones. I'm trying to use every word that you could possibly hear when this problem is described, can make bones break very easily. Things that you can do. Exercise. Exercise can help these individuals in so many ways, but it also helps our bones become strong and stay strong. So we want to try to offer and encourage exercise daily. You want to administer calcium, vitamin D, and other medication as ordered by a healthcare professional. If a person with Prader-Willi syndrome is not on calcium or vitamin D, I would question the healthcare professional, should they be? All falls and injuries should be closely evaluated and monitored. Physical therapy, braces, daily exercises may be prescribed for spine problems. Next, we're going to be talking about the emotional, behavioral, and mental health concerns of persons with Prader-Willi. Many people with Prader-Willi syndrome face emotional and behavioral challenges. They thrive on structure and consistency. They do not handle changes very well at all. Food-related issues and topics often cause anxiety and emotional upset. Some may have extreme behavioral outbursts resulting in destruction of property or assault on others. There are some that also may have a diagnosis of a mental health problem. Some may have depression, some may have bipolar disorder, just as a few examples. Things that you can do. You want to do your best to provide structure and consistency in their life. They do well when their day is predictable. Don't argue with them. When you talk to them, use a calm and supportive voice and style. I can't tell you, especially when Tony was in high school and I would get phone calls and I could hear Tony screaming and yelling in the background, and I could also hear staff yelling in the background. I would say, okay, first of all, tell the staff person to be quiet, okay? He's not hearing you, he's out of control. In a calm voice, get him to a calm, quiet area. So they need your support. They need an environment that's going to help them get to a calmer state. If you do know that there's going to be changes, prepare and discuss those changes, especially when they're related to food issues. Be prepared that the person may show some anxiety. You can also put the change in writing. It helps them to process it and uses another tool in the toolbox. You want to teach, encourage, and praise when they are using words, when they're frustrated, and that they are displaying appropriate behavior rather than physical outbursts. Tell me how you're feeling. Are you feeling frustrated? And if I'm frustrated, and they use a louder voice, it's okay. It allows them to kind of get it out and share what the feeling is inside. Once again, putting things in writing is often helpful. Maintain food security. Oftentimes, when they're in an environment where there is access to food and they are being asked to control themselves, that can cause anxiety, that can cause more behavior outbursts. They can only do it. Some can't do it at all. Some can only do it for a short period of time. Next, I'm going to go on to skin picking. Many people with Prader-Willi syndrome pick at their skin and many opens of their body. You can see it in their nose, their rectum, nails. Preventing and treating and managing this problem can be very challenging. Pain is not often a factor. Wounds can be chronic, severe, and I'll be honest, they can also be confused as a sign of abuse. Things that you can do: keep hands busy. Some examples include stress balls, activities, limit the time alone, because when they're alone, they can start picking. Keep nails short. Apply lotion to the skin to keep it hydrated. Skin that's very dry, just in you and I, can crack and open very easily. If thing is well hydrated, it's slippery, it is more difficult to penetrate, so it limits the amount of damage that could be done. Some may require supervision when they're going to the bathroom. You may want to cover with a bandage, with clothing, and in some cases with both. What you're trying to do is to restrict or limit access. And it also, if you see them poking at something and trying to take something, it allows you time to try to provide some diversion and reinforce so that they're not doing more damage to the skin. In severe cases, medication may be tried. You want to monitor for signs of infection, which include redness, warmth, and/or drainage. The next topic that we're going to be talking about is medication sensitivities. So many people with Prader-Willi syndrome can and are extra sensitive to many medications. Some of the medications that can cause more problems include pain medications, especially strong pain medications like narcotics. They can cause extreme sedation. Medications used to treat diarrhea, they may cause the intestines to stop working entirely. Sedative medications, they may cause over-sedation. And I'll be honest, these are often the types of medications that are used in procedures to diagnose and treat problems like a colonoscopy or dental procedures or surgical procedures. So when you go in, you need to make sure we're educating them and preparing them. They may use a lighter dosage, and many times they end up requiring overnight hospitalization just because of the extreme reaction to these medications. When a person is having surgery, anesthesia, they may be slow to wake up, and they may also experience prolonged sedation. Medications used to treat mood and behavior, they may experience more sedation and other side effects than other people would. So things that you can do. First of all, as caregivers, you need to know the medications you are giving. If you think somebody is having a problem or is becoming over-sedated, contact a supervisor or a healthcare provider. Do whatever your policy within the environment that you are working, but make sure you are communicating your concern. Don't be afraid to help educate the healthcare professionals about this sensitivity. Remember, you may be the primary educator for these individuals. Share handouts that are available through the PWSA USA website or app. You want to encourage the provider to start a dosage low. The motto, start low and go slow with any increases, is commonly advocated for. You want to limit use of medications used to treat diarrhea. They can cause the intestines to totally stop functioning. Next, we're going to be talking about breathing concerns. Many people with Prader-Willi syndrome suffer from a number of different breathing problems. One is called central hypoventilation disorder, and this happens when there is a decreased breathing rate or depth, particularly during sleep. Just very shallow breathing. But when this occurs, what it can cause is problems with daytime sleepiness. And if it's significant, it can also cause an elevated pressure in the lungs. People with Prader-Willi syndrome may be at increased risk for this due to their decreased muscle tone and the decreased muscle mass, those that have excessive obesity, and there's possibly a decreased drive in their brain for them to breathe. Central apnea means that there's a complete stopping of breathing during sleep. The origin of this type of sleep apnea is in the brain. And there are several documented studies that show an alteration in the response of some individuals with Prader-Willi syndrome to the chemicals that would normally increase breathing. Third type of problem is obstructive sleep apnea. And this is well known to occur in people with Prader-Willi syndrome, as well as other syndromes that have poor muscle tone, such as Down syndrome. So this results when an individual is trying to breathe while they sleep, but due to a blockage or obstruction in their airway, in their throat, no air enters the lungs. Many of these individuals have loud breathing and snoring associated with periods of quiet, where there's no air movement at all. And for some of us, we may also hear these sorts of problems in our spouses. This is a very common problem that we're seeing in the general population as well. Untreated obstructive sleep apnea can have serious complications, including death. The fourth type of breathing concern I'm going to just briefly touch upon is weak chest muscles. Because people with Prader-Willi syndrome just have generalized weaker muscles, especially in the area of the chest, they are at greater risk of respiratory infections, including pneumonia. So what are some things you can do? If sleep apnea is suspected, a sleep specialist should be consulted. The use of continuous positive airway pressure, which is also called CPAP or BiPAP, are often prescribed to help keep a person's airway open while sleeping. And it can be challenging to get the person with Prader-Willi syndrome to use it and comply with this therapy. I can tell you, my son has been on CPAP since he was age 10. And the first night that they prescribed it, I was given really no guidance in how to get started with it. I don't think he got much of any sleep, and I know I didn't get any sleep that night. You need to use incentives. Go slowly. First of all, first night, just maybe having them put it on their face. Don't even turn the machine on. Get them used to having that sensation. Then maybe the next night you have them put it on while they're watching TV, and maybe you just put the machine on for 3 minutes. The next night you put it on for 5 minutes. You want them to gradually get used to that sensation and get used to having that in place. And then once again, using incentives for their willingness to comply. As caregivers, you also want to make sure to clean the CPAP and BiPAP equipment as instructed and to order new supplies as directed. A persistent upper respiratory infection should be evaluated by a healthcare professional. These individuals can develop pneumonia and severe lung infections far easier than you and I could. Hospitalization, special consideration. So when a person with Prader-Willi syndrome is hospitalized, they need extra support and advocacy and education of the hospital staff. Remember, many healthcare professionals do not know about Prader-Willi syndrome, and you're going to be the primary educator and advocate for the person you support. It's not uncommon for persons with Prader-Willi syndrome to gain a great deal of weight while they're hospitalized. Many people with Prader-Willi syndrome have cognitive or learning limitations and may not be able to provide accurate information about their condition or their medical history. And also, many diagnostic testing and or procedures require a person to have anything to eat or drink for a prolonged period of time. And this can be very difficult for the person with Prader-Willi syndrome, and they may seek out food or drink. Some higher need areas for the person while they're hospitalized includes food security and ordering of food. I don't know if you've been in a hospital lately, but now most food and meals in a hospital are ordered restaurant style. You're given a menu. You can pick and order what you want, when you want. So there needs to be close adherence of who can place the order and what can be ordered. Another challenge is IV access. Many people with Prader-Willi syndrome have challenges with blood testing and inserting of IVs. Once again, medication sensitivity. They may be sensitive to many medications that are being utilized in the hospital setting. Pain medications, sedatives, anesthesia. You want to access information on the PWSA USA website. I have included the hospitalization, the alert for inpatient caregivers, but there's other handouts that we also have available, including the psychiatric admission guidelines for inpatient, anesthesia in Prader-Willi syndrome, warning on what medication combinations could be fatally impair breathing in persons with Prader-Willi, post-operative monitoring of patients with Prader-Willi syndrome, treatment recommendations. These are just some of the resources that PWSA USA has available for you to share with healthcare professionals. Close monitoring of the person to make sure that they are not eating or drinking when they should be fasting. My son was just recently hospitalized last fall, and we were there bright and early, did stay overnight on occasion just to make sure that diagnostic testing would be performed and that Tony wouldn't take food or have access to food. Insist on an experienced person to do blood draws and or inserting IVs. And in many healthcare institutions, they have a team of professionals trained in how to do this for people that have extra challenging veins. Resources. Our big thing is that we know that remembering all of these health issues can be very challenging, but there are resources for you that you can access and that you can use to help you and help healthcare professionals care for the person with Prader-Willi syndrome. PWSA USA has a free downloadable phone app. There is the PWSA USA website. There are many health handouts. There's the medical alert booklet that you have included in your handouts that can be accessed through there. There's also physician consultations, physician to physicians, experts that are willing to talk to healthcare professionals out in the community. And this can be done by contacting PWSA USA at their toll-free number to help facilitate this communication. In summary, people with Prader-Willi syndrome face unique health challenges, and in many ways, their body just works different than yours or mine. You are a very important part of the health team that this person needs to safely access healthcare promptly and be an educator and an advocate for that person. Some of the most common health issues have been highlighted today, along with some suggestions on things that you can do to help. I hope that you feel more informed and aware of the resources that you can use to help you educate and advocate for the health needs of the person with Prader-Willi. Thank you. And now we will take questions.
So there is one.
Okay.
Actually, there's a couple from the chat. How does it work if one of the residents needs the puree diet, but the others do not?
Okay. I know in one case where this happened, what helped was before pureeing the diet or the food, you would show the person with Prader-Willi what the food was. So let's say if it's chicken or whatever, and vegetables, you show them that it is, and you can do it pretty much the same with others. You show it to them, and then you go take it and puree it, and then they're more accepting of it, that they will be able to have what the other people are having. So that's one suggestion that I know was very helpful.
Okay, so there's another one. Any meal and snack ideas readily available?
Well, I'm one to say, like, for snack ideas, anything that like yogurt that you can get in small containers that can be easily transported. Well, you know, there's many handouts and idea. I mean, that could almost be a whole topic in itself. But applesauce, you can use yogurt. You can do a soft cheese. I'm always looking at, you know, trying to get healthier food options. You know, I used to even send cooked vegetables in a small thermos with Tony to school, and so that he could have warm cooked steamed vegetables. Meals, I do have a handout. What do we end up calling it? Hidden Gut Issues. And it's available on the PWSA USA website. It goes into more detail about this topic. It gives, I believe I provided 5 days worth of sample menus and ideas for, and I used a 1,000-calorie diet as an example, as a guideline for you. So it's called Hidden Gut Issues, and it's available on our website.
Okay, so I think there's a couple more along these lines. Is there a resource for agency dietitians to develop an appropriate menu? Are there any specific resources for these food ideas?
Well, I think there is also, I think, a handout available for dietitians, and I can't recall the exact name of it, but go to the PWSA USA website, and if you go under medical, and then you go under, they're alphabetized, and I would maybe just do a search for dietitian or dietary, but the Hidden Gut handout does outline kind of the challenge we face is that many people with Prader-Willi syndrome have the gastroparesis, which is a low fiber diet, and then constipation, which is generally a high fiber diet. That's why the recommendation is for a lower fiber diet, and what the fiber we're giving would be to try to make the fiber we're giving more user friendly for the stomach. So that article in particular addresses that, and hopefully that will help the dietitian, because I also gave some resources from, I think it's the American Academy of Gastroenterology.
Okay. And all of the resources that Barb has listed, the handouts that she was referring to in the training, are on our website. What I can do, it looks like someone also said they didn't register, they don't have the documents. So what I can do is I will add the documents right now to the chat boxes, and you can just download the documents if you just want to hold on a little bit. Otherwise, they are available on our website, and the website is cow.weisman.wisc.edu. That's cow.weisman.wisc.edu. And you can also send me an email asking for information. My email address is kind of long too. It's weingarten@weisman.wisc.edu. So that's WEINGARTEN@weisman.wisc.edu. But in the meantime, I think that's the rest of the questions that from the chat, except for the handouts, which I will include right now. So,
And one thing I would just like to say in closing is that I am in the process of creating what I'm going to call a package of information for caregivers that they can utilize. We will be utilizing this webinar or this presentation that they can hopefully share as a training tool. The handouts. I will also am in the process of creating some monthly health tips that caregivers can share with staff and use in a wide variety of way to kind of reinforce, re-educate, remind people. And I'm hoping to have this on the PWSA USA website in the next few months. PWSA USA right now is undergoing a website upgrade, and so I can't really put it out there quite yet. They're hoping to have it completed by August 1st. If I can have it up sooner, I will. But helping caregivers understand the health issues of people with Prader-Willi syndrome is near and dear to my heart. And I'm going to try to make more and more resources available at your fingertips. So stay tuned to the PWSA USA website as well, so that you can hopefully utilize these resources in educating yourself as well as training for the staff that you may be supervising.